One of the most common changes during the first pregnancy is the change in tissues of the breasts as it prepares itself for breastfeeding. However, there are also some other changes noticed during the first pregnancy. Common breast. One such change noticed is the pain in the breast. It is a common symptom in the first 3 months. Some women also get this pain with the commencement of period. So this change often goes unnoticed. It is one of the reasons why women avoid sex in the first 3 months. Sex during pregnancy is safe, but the touch on the nipples is generally avoided. Another change is in the nipples. The color of the nipples becomes darker and larger as one's pregnancy advances. Among the normal symptoms in the nipples are pimples and small goose bump on the white areas on the areola. This is known as Montgomery's tubercles. Yet another change noticed from 4th to 6th month is the enlargement of the breast. This is again due to the change of the tissues in the breast and a preparation taken to nurture the coming child. Leaking of colostrums is a common symptom during the late pregnancy. It is often noticed that a golden-colored fluid comes out of the breast or a coating is formed on the nipple during the late pregnancy. This substance is known as colostrums. To avoid this being noticed, breast pads are generally used. Breast conditions pregnancy. In some cases it has been seen that women have slight or no change of breast. But this does not mean an inability to nurture a child. There are innumerable prejudices and wrong conception about breastfeeding during pregnancy. There is a myth that if the colostrums do not come out before the baby is born, then one cannot expect breast milk. But in reality, colostrums can come at any point of time, even just after the birth of the baby. Again, some people believe that the nipples should be rubbed during the pregnancy in order to avoid pain during breastfeeding. But in fact, this experiment has not proved to be successful, and pain during breastfeeding is felt due to dislocation of the child position during feeding. Thirdly, people believe that they cannot feed their child with larger and bigger areola, but the truth is that the larger and darker areola enables the babies to see properly. Some have an idea that small breasts produce insufficient milk to the baby. But it's the need of the baby and not the size that determine the amount of milk produced.